Good evening, viewers of ATV. My name is Dr. David Mark Maiga. I work with Star Medical Center, located in Mbarara City, Nyamichobola Cell, opposite the Nyamichobola Police Post. Today, we are going to have a talk about prostate cancer. You see, prostate cancer is on an increasing rate among men. And today I chose that topic to give more light about it, such that people can devise all means of getting it reduced in numbers. So basically, before we go to talk about the prostate cancer, we need to know what the prostate is, where is it found, who has it and who does not have a prostate. So basically, when we talk about prostate, of course that will refer to men only. Ladies do not have prostate. So basically, a prostate is a part of the male reproductive system. It is actually found below the urinary bladder of the urinary tract system of a man, and it is in front of the rectum. That is the terminal end. The rectum is the terminal end of the gastrointestinal tract. So the prostate is found just below the bladder and in front of the rectum. So I hope as we continue to discuss, I will talk about the rectum and talk about the bladder. I hope you don't get confused. It is where we find the prostate. The prostate is located. So basically, what is a prostate cancer? This is cancer of the prostate. And any cancer means there is abnormal growth of cells in that particular part. So if we talk about prostate cancer, we mean there is abnormal growth of cells found in the prostate. The prostate performs a function of secreting semen that helps to transfer or transport sperm during ejaculation. It actually prevents the sperms from lodging in the urethra or from clogging in the urethra. So basically, what are the signs? What are the signs of a prostate cancer? Or even before we talk about the signs, what is that thing that increases the risk of someone getting a prostate cancer? So in most cases, you find prostate cancer is among men alone. Of course, gender, it is in men alone. And then you find age. You see, as a person grows older, especially that is men, if they grow older, actually above the age of 65 years old, they start having prostate issues, and their risk of getting prostate cancer increases as they grow. That is usually above 65. So basically, it is better someone thinks of doing a screening of prostate cancer once they age 45. They start screening, such that if any problem is found out, we can have a quick solution about it. Then the other thing is family history. Prostate cancer, for someone who has had relatives battling with prostate cancer, is at a very great risk, very high risk of developing the same thing. So people who have had their relatives treating prostate cancer or suffering from prostate cancer, you find they really stand a higher chance of having prostate cancer after that age of 65. The other thing is basically sex. Prostate cancer is actually among men alone. And the other thing is obesity. People who have higher weight for age, or higher weight for higher weight for age. People who are obese, who have a higher body mass index, are at a high risk of developing prostate cancer. So people who do smoking in any form, be it cigarette, be it marijuana, any kind of smoking, it increases the risk of someone getting prostate cancer. Then the other thing is chronic prostate infections. For someone who has been treating recurrent prostatitis, BPH, those people are at a risk of getting prostate cancer. Then the other thing is diabetes. See, patients who are having diabetes or who are battling with diabetes, they stand a higher chance of developing urinary tract infections, of which prostatitis is one of them. And yet we talked about chronic prostate infections can increase the risk of getting prostate cancer. So someone who has diabetes stands a higher chance. Then for someone who does not do enough exercise, people who are not used to sweating, of course if you don't sweat you're going to put on weight, they also stand a higher chance of developing prostate cancer. Then the other thing is people who are much exposed to radiations. So radiation beams have a tendency of bringing abnormal growth in the cells. So if a prostate is consistently exposed to radiations, or if a person is consistently exposed to radiation, stands a higher chance of developing prostate cancer. So allow me to go to the signs and symptoms of prostate cancer. When should someone look at a person and they be like, oh, this person is actually likely to have a prostate cancer? Or when you experience any of these signs, you really need to go for a checkup. These are the signs of prostate cancer. I'll tell you, in many cases, many of these patients are asymptomatic. They do not usually show any serious signs or symptoms, but yet when you do a screening, you find they are really infected with prostate cancer. So you'll find many cases will present asymptomatic. Then these signs are really divided into three. We have signs due to normal function of the urinary tract system. Those will be symptoms of the lower urinary tract system. Then we have signs that are due to local invasion, that is invasion of the prostate. Then you find that we have symptoms. We have also other symptoms due to the metastasis, where you find the cancer has even spread. So you find for the normal function, for the increased normal function of the prostate, we shall have symptoms like a frequency of urine. You find someone urinates so many times, be it daytime, be it night time. You find someone urinates like 8 times in a day, 8 times in the night. So that is what we call frequency. That is one sign of prostate cancer, someone to be thought of having a prostate cancer. Then the other thing is incontinence, where someone cannot control, someone do not have the urge to control. Like this time I'll let the urine go out, or I can wait a bit. It is also a sign of prostate cancer. Then the other thing is urgency, increased desire to urinate. You don't usually have you usually have the urge, increase the urge to let urine out. Then the other thing is terminal dribbling. Terminal dribbling is where you cannot form a good stream of urine. You find people are just having drops from the urethra. That is dribbling. And the other thing is hesitance. Hesitance, you find someone is having difficulties letting out urine. You see, in most cases, when the prostate is having issues of the cancer, it enlarges in size, and in that case, it actually reduces the radius, actually the diameter of the tube that is passing through it, and that tube is the urethra. So once it enlarges, it actually reduces the diameter of the urethra, and hence you have hesitance, you have reduced ability to pass out urine. So the other signs, we shall talk about the signs due to local invasion. Once the prostate is locally affected, we have these signs that will show us that this person is likely to have a prostate cancer. One of the signs is urinary obstruction. So when the prostate is really affected locally, it can cause a blockage of the tube that is passing through it, and hence that person will not be able to completely pass out urine. They will come complaining of, I feel like I have a full bladder and urine is not coming out. So that is also a medical emergency, where you find someone is having an acute obstruction, urinary obstruction. Then the other thing is hematuria. Like the way you hear the word hematuria. Hematuria is blood, then urea is urine. People with prostate cancer will also report cases of urinating urine that is containing blood, or that is blood stained. That is called hematuria. It is also another sign. Then the other thing is hematospermia. Hematospermia, the way you hear hematospermia, is sperm containing blood. So usually if the prostate is infected, it will secrete semen that is containing blood, and during the time of ejaculation, that person will let out a sperm containing blood. Then the other thing is erectile dysfunction. You see that prostate, once it secretes semen, it triggers erection. So if it is affected or it is having cancerous cells, this person will have difficulty maintaining an erection. Then the other signs I want to talk about is the signs of prostate cancer due to metastasis. That is when the cancer has spread to other parts of the body. You find through the lymphatic system, it will go to the lymph nodes, and if it is actually spread through blood, it will go to the lungs, the bones, and the liver. So these are some of the signs. You find someone who has had metastatic prostate cancer, this person will be extremely weak. That is scientifically called lethargic. This person will not have appetite, that is anorexia, and this person will have weight loss. This person will have like reduced weight. They will have pain in the testicles, pain in the lower back, and pain in the pelvic region. Then still, due to the spread of cancer to other parts, these people will have pathological shortening of the bone and fractures. So when someone has a metastatic cancer, they will report fractures of the bones due to the metastasis, due to the bone, causing bone pathologies. Then the other thing I want us to talk about is how do we do a cancer screening? So in most cases, there is no active screening plan for prostate cancer, but currently in facilities, there are tests we do, and we actually recommend people to continue doing these other tests that can isolate them of having a prostate cancer. So commonly, I will do a test called a PSA and a DRE test, DRE. DRE is a digital rectal exam. I remember from the start I talked about the rectum. So during a screening, we do a digital rectal exam. Digital, I mean the finger. So a health practitioner will insert a finger in your anus. And remember, the prostate is just anterior, is found in the anterior part of the rectum. So when someone inserts a finger in the rectum, you can tell that the prostate is first of all tender. When you try to move a finger, this person will feel some little pain. And still, you can feel if it is nodular. You can feel the texture if it is rough. So like those are all signs of prostate cancer. And then on the examination finger, you can still have blood during the procedure of digital rectal exam. Then the other test we do is a PSA. A PSA is a chemistry test. PSA is prostate surface antigen, prostatic surface antigen. This is an antigen or a chemical produced by the prostate. Every man has this PSA has this antigen, but the level or the amount differs in a sick person and in a normal person. So you'll find for any normal person, a PSA of any normal man will be will be between 0 to 4. It shouldn't go beyond 4 nanograms per liter. And you find increased PSA is not so specific for a prostate cancer. It is really not so specific. But once the antigen has really increased in amount in blood, then we also start thinking of a prostate cancer. Then, however, we also have increased the prostate surface antigen in cases like UTIs, especially acute cases. We have increased the PSA in cases like benign prostate hypertrophy, hyperplasia rather, where the cells of the prostate increase in size. Still, we shall have increased the PSA, like prostate surface antigen, in cases like prostatitis, when the prostate is inflamed, when it is fully inflamed. Then the other thing is during ejaculation, these prostate surface antigen tend to increase in amount. So even in prostate cancer. So you find this is not basically an active screening program for prostate cancer. However, we are called upon to perform these two tests, the digital rectal exam and the PSA, to screen out people having prostate problems. So basically the other thing on the digital rectal exam, we shall look at the shape and size. When a health practitioner inserts a finger, they will look at the shape and the size. This prostate can be enlarged in size, bigger than the normal size. It can still be nodular, forming nodules. It can still be fixed like in one position, you cannot move it. It can be firm and it can be tender. Once you try to move the thing and place it on the prostate, this person will report pain. Then the other thing I want us to talk about is actually grading. You see, in most cases when we are grading and staging of cancer, briefly I'll talk about it, but this will help us to find which treatment options will be good for a particular person with prostate cancer. So basically with grading, grading will tell us how abnormal the tumor cells, that is the cells of the prostate cancer, differ from the normal cells, especially when put under the microscope. Still, grading will help us to know how quickly the cancer is growing and how likely it is to spread to other parts of the body. So you see, grading is really very important in management of prostate cancer. Basically, it tells us how abnormal the cells are, and basically it will help us to know how big it is growing and how likely is it to spread to other parts of the body. Then the other thing is staging. Basically, we have 4 stages of prostate cancer. Then the staging will help us to know how big the cancer is and whether it has spread out of the prostate to other body parts. Usually during the spread, like I talked it about before, prostate cancer spreads only in 2 ways. It can spread through the lymphatic system, and then it will go to the lymph nodes, and once you palpate the inguinal lymph nodes, these will be enlarged in case of prostate cancer. The femoral lymph nodes will also be enlarged in case of prostate cancer. Then once it spreads through blood, it will go to the lungs, causing lung cancer. It will still go to the bones, causing bone cancer, and to the kidney, rather to the liver, causing liver cancer. So we have basically 4 types of prostate cancer. We have stage 1 and stage 2. Here in stage 1 and stage 2, we have localized prostate cancer. Stage 1 and stage 2. Localized and mean the cancer is restricted to the prostate alone. It does not affect any nearby part, or it does not go through the blood to anywhere, but the cancer is found is localized or is restricted to the prostate alone. Then we have stage 3, commonly known as localized advanced prostate cancer. This is where the cancer cells will spread to the nearby body parts, those parts that are near the prostate. Those include the rectum, the bladder. Still, a person who is in stage 3 can be found with bladder cancer originating from cancer of the prostate, and then the rectum, cancer of the rectum, still originating from the cancer of the prostate. Then stage 4 is where we have the metastasis, where you find cancer has spread to other body parts. Of course, metastasis happens through the lymphatic system, spreading, causing cancer of the lymph nodes, and then it will still spread through blood, causing bone cancer, that is an osteocarcinoma, and causing liver cancer and lung cancer. So the other thing I want to talk about, I think I'm done with the grading and the staging. Staging, we have 4 types of prostate cancer, 4 stages of prostate cancer: stage 1, stage 2, stage 3, and stage 4. In stage 1 and stage 2, the cancer is primarily located in the prostate alone, where you find in stage 3 it has spread to the nearby parts, and stage 4 is where we have the metastasis, where the cancer has spread through the lymphatic system to the lymph nodes, causing cancer of the lymph nodes, and it also spreads from the prostate to other body parts through blood, causing lung cancer, bone cancer, and liver cancer. So allow me go to the investigations done during on a patient with prostate cancer. So basically, there are very many tests we can do for someone with a prostate cancer, but commonly these are the tests we do. So of course we have specific tests like biopsy, where they actually get a piece of a tissue from the prostate, and this is taken to the lab to actually examine and to do the staging, where they can isolate this person is in stage 1, this person is in stage 2. So a biopsy is really appropriate in staging. Once we do a biopsy, it is appropriate in staging a prostate, a stage of cancer, and then finding an appropriate management plan. So this biopsy can be got transurethral and transperineal. So transurethral is where they put a probe through the urethra and really get to the prostate and get a part of the tissue, which is taken to the lab for microscopy and staging and finding an appropriate management plan. However, usually during this biopsy, they usually use a method of getting the biopsy called transperineal, where they pass through the rectum and get a piece of the prostate. So you'll find this is associated with so many infections. It is actually comes with a lot of infections because the rectum is having feces, and once the feces get access to the blood, you have sepsis, bacteremia, which can turn out to be so fatal to life. Then the other test, apart from the biopsy, we shall do, of course, a digital rectal exam is also a test, and you find we try to find the shape and the size of the rectum. We do a PSA, prostate surface antigen. People with cancer of the prostate have increased levels of prostatic surface antigen. We also do that PSA. We do free total PSA ratio. Then the other thing we do is liver functional test. Like I told you, once we have metastasis, when the cancer is spread, it will affect the liver through blood. Cancer cells can go to the liver, and therefore we do liver function test to find if the liver is still fine. We do urea and electrolytes. We do a full blood count. We also do multiple magnetic resonance imaging. This will show us how much the cancer has spread and how basically we can handle. So you'll find during metastasis, we can add bone CT scan to rule out metastasis, chest x-ray. Still we can do a chest x-ray to rule out metastasis to the lungs, and basically abdominal CT scan to rule out metastasis to the liver, and basically to the liver, abdominal CT scan will rule out metastasis to the liver, basically that. So basically those are some of the investigations we can do when we are trying to handle a patient with prostate cancer. Then the other theme we need to talk about is the management plan. You see, cancer is very fatal, and I'll tell you one thing: once prostate cancer is found at an early stage, it is curable through surgery. You get the point? So basically, among the management plan we have what we call surgery. We can have a radical prostatectomy, where they remove the prostate, and of course that one comes with so many complications. But when someone has aged and they remove the prostate, I think it is not so much desirable to have a prostate when you're painting and you're above 65. So if they do radial prostatectomy, that means complete removal of the prostate that is affected. That is if stage, because the management plan will actually depend whether someone is in stage 1, stage 2, stage 3, or stage 4. So you find if someone is in stage 1 and stage 2, we can do a radical prostatectomy where we remove the prostate completely, and this will save a person from that issue of prostate cancer. Then, however, complications can still occur from removing the whole of the prostate, where we have recurrence. If they remove residue, if they leave residues like residue cells of prostate cancer during the surgery, it can cause a reoccurrence of prostate cancer. Then of course infertility, someone who has had their prostate removed completely, they become infertile. They face a problem called secondary infertility. Then they also have a problem of erectile dysfunction. So that person who has had their prostate removed, they cannot sustain an erection. They cannot even initiate. Beyond sustaining, you cannot even initiate an erection if you have your prostate removed. Then the other thing is urinary incontinence. You find in many cases of people who have had radical prostatectomy, they face a problem of urinary incontinence where they cannot control, where they lose, usually during a surgery, it affects the sphincters of the bladder, that person cannot really control urine output. So the other thing is, the other management plan is radiotherapy, where we have a beam of radiotherapy directed to the prostate, a beam of ultrasound rays directed to the prostate to kill cancer cells. Of course, this also comes with a lot of challenges, where you find it can actually affect the bladder being near the prostate. It can also affect the colon and the rectum. And once you direct a beam during radiotherapy, you can still cause the cancer to disseminate to the rectum, to the colon, and to the bladder. So the other thing is hormonal therapy. So you find in most cases, many of these prostate cancer problems are linked to androgen problems. And in most cases, you find someone is put on hormonal therapy during cancer treatment. And hormonal therapy will include luteinizing hormone-releasing hormone antagonists. Examples of guselelin, someone is put on drugs for some time, like buselelin and guselelin. Then we also have GnRH antagonists. They will also help in hormonal therapy during management of a patient with prostatic cancer. Then the other thing is bilateral orchidectomy. Orchidectomy is removal of the testes. So you find they also plan to remove both testes and the bladder too, and rather the prostate too, for someone who has had prostatic cancer. So in most cases, you see cancer, the other management plan we have is palliative care. Palliative care is actually directed to improve the quality of life, especially for people who have had metastasis. We just improve life. If someone is meant to live for a few years, he should have quality life. Then the other thing is chemotherapy, where cancer has spread. We also think of chemotherapy just to improve life and reduce symptoms. So basically, management of someone with a prostatic cancer, it is multidisciplinary, where you find people, counselors, medical workers, nurses, urologists, medical workers. It is a team. That team is actually, all the aim is to improve their life, where the urologist will do a surgery, the nurse will take care, the person follows medication, the counselors, they will have to counsel those people about their way of life. So basically, that's what I can tell you about the management of prostatic cancer. Then lastly, I want to talk about the preventive measures. So we have seen the complications of the management plans. We have complications of prostatic cancer. Once someone has had prostatic cancer, we expect some complications, common complications. One is sexual dysfunction. So if someone has had issues with the prostate, they will usually report reduced libido and reduced sexual power. So the other thing is urinary obstruction. These people will always report obstruction of urine. Then the other thing is metastasis, complications of prostate cancer. Cancer can spread to the lungs, to the liver, to the lymph nodes, and to the bones. Then lastly, we have the preventive measures. Let me go through briefly the preventive measures of prostate cancer. What should we do to reduce the occurrence, reduce the prevalence of prostate cancer among us men? So basically, all men are urged to stay sexually active. It is actually, I don't know, it is an hypothesis that every man who is sexually active, every man who ejaculates daily with or without a sexual partner is at a low risk of getting prostate cancer. Then the other thing is increased vitamin D. So eat more fruits. You get vitamin D, especially people who have had a lot of vitamin D in their diet. report low risks of getting prostate cancer. Then of course, stop smoking and drink less. Avoid smoking. Smoking can cause any type of cancer. Then the other thing is do regular exercises. You find people are urged on sweating, especially elderly people above 45. Do exercise, some small strenuous exercise, and see that you sweat daily. Then the other thing is maintaining a healthy weight. Obese people are at a risk of getting prostate cancer. Then the other thing will be reduce fat intake. Lastly, you reduce fat intake. As long as you reduce the fats you eat daily, your risk of getting prostate cancer also reduces. So allow me to stop from here. I wish you well. Thank you for watching 8TV. Bye.
You're watching 8TV, empowering you.